All right, good day, and thank you all for joining us at this important in-person briefing. I appreciate my colleagues from the other healthcare systems that are part of the St. Louis Metropolitan Pandemic Task Force being here today. The clinical teams, especially the nursing staff, are represented here on the stage or on the front lines of the surge in the pandemic. I'd also like to welcome the nurses, physicians, healthcare leaders from across the state who are joining us remotely today for this important announcement. You'll notice them all on this Zoom meeting here on the wall. In particular, I'd like to thank the St. Louis Metropolitan Medical Society, the Missouri State Nursing Association, the Missouri Foundation for Health, the Missouri State Medical Association, the St. Louis Regional Health Commission, and the St. Louis Integrated Health Network, who have joined us here today in support, all virtually, of course. So for months, we've talked about a time when we would run out of options, a time when we would run out of space to care for sick patients, when our options would be limited, when the virus is hitting us so hard that the healthcare system we have would be unable to address the people's needs. That terrible time gets closer with each passing minute, each passing hour, and each passing day. The number of people with the virus is skyrocketing in our region. The number of people so ill that they have to go to the hospital is nearly 3 times what we described as a sustainable level. The number of people with COVID in our intensive care units is higher than ever. And the weather is getting colder, and it could not come at a worse time. The real peak of this pandemic has yet to come. At the pace we're on right now, we could easily double the number of COVID patients in our hospitals within about 2 weeks. At that point, we will not have the capacity we need to sufficiently care for our patients, not just COVID patients, but all patients. So the best time to act was really yesterday, but a good time to act is now. For months, we have talked about what individuals can do to protect themselves and others from the virus. And for months, that individual behavior has made important and life-saving differences. Unfortunately, as has been painfully obvious to even a casual observer, we are past the time when individual behavior alone can address this disaster. Healthcare systems across Missouri need Governor Parson and the state to take additional action to prevent unnecessary illnesses and deaths. We need the state to act if we want to ensure our hospitals, both rural and urban, won't have to turn away sick patients. We need the state to act if we want rural hospitals to be able to refer critically ill patients, not just COVID patients, to our high care facilities, and not spend hours on the phone and then send patients to Iowa or other far-reaching places to receive care. We need the state to act against the virus if we want to keep the economy functioning and if we want to keep schools in person. Today, the St. Louis Metropolitan Pandemic Task Force, caregivers, nurses, physicians, and healthcare systems around Missouri are asking the state to take important steps to help get us through this daunting peak in the virus. It is time. Today we are asking the state to initiate a statewide mask mandate for Missourians when they are out in public. Increasing the use of masks over the next several weeks statewide will slow the incredible pace of this virus. It will give healthcare systems and workers a chance to take a breath, to keep up and provide the appropriate level of care for our patients who so desperately need it. Now, I know that Missouri Governor Parson indicated he believes mask mandates should take place at the local level, and maybe that was true early on in the pandemic. However, when it comes to the virus, we are all one big county now. Every day, COVID patients are crossing county lines to go to hospitals. The lack of a mask mandate in one county has implications for residents and healthcare professionals in other parts of the state. The spread and cases are blanketing the state, and no locale is safe anymore. In short, making a mask mandate a county-by-county question is not going to buy healthcare systems the time they need to save lives. So let me be really, really clear on this. A statewide mask mandate is needed to save lives across the state. I've also heard the argument that it's challenging to enforce these mandates, but I think if Missourians heard from leaders how critical the situation is and how their friends, neighbors, and hospitals are at risk, I believe more would wear masks. I also believe that this would allow local businesses to do what they believe is the right thing for their customers, only they would not feel pressured to make the rules. Regardless, as a society, we have never relied on a cop on every street corner in order for us to follow rules. I believe people will follow practical and logical mandates when they hear from leaders that they are necessary to protect them and their neighbors. The healthcare professionals here today are convinced that over the next several weeks, there is no greater threat to our communities and to our state than COVID. More masks will save more lives and more businesses. Secondly, we are also asking the state to work with our system's emergency managers to start planning for what will happen when the healthcare systems become overwhelmed. Our healthcare heroes have fought valiantly day after day, but we have no reserves. We have no backup that we can suddenly muster to come in and save the day. If we stay on the path that we're on, even just 2 more weeks, we will not have the staff we need to care for patients. It's now just a numbers game. We are danger close. The time to plan to take care of patients is now, because we could need that additional space and staff sooner than anyone suspects. Finally, we are asking for a statewide safer at home policy. Such a policy would limit the face-to-face interactions and decrease the spread of infections. This policy would instruct residents to stay home except for specific things such as school, going to the store, seeking medical care, among other things. This would greatly help slow the spread of the virus by eliminating social gatherings that we know continue to be the avenue for sustaining this great pandemic. These significant actions by the state would help rural and urban healthcare systems around the state deal with the surge we are already facing. If we implement these steps today, we still won't feel the results for a few weeks, but it will make a difference. But if we do not implement these steps, we will lose more lives. If we do not implement these steps, healthcare workers and hospital systems will be unable to keep up. If we do not implement these steps, more and more patients who need care will be turned away by hospitals in Missouri. However, it is not just up to the state. We must all do our part. As I have said many times before, it takes everyone, and by that I mean everyone, to do their part, including wearing a mask, social distancing, not gathering in groups. Many of you have heeded this advice, and I am so grateful for your actions. And I'm sure I speak for everybody up here on the stage and on our Zoom meeting. We very much appreciate the selfless sacrifice that many people have made for the greater good. It's hard for me to imagine where we would be without these individuals. But now it's up to all of us, the government and the people of this great state, to come together as one. It's up to all of us, each person, each leader, to do whatever we can to help Missouri through this disaster. We must all be prepared to get through these next few weeks and months. These will be the most challenging months in the pandemic. Now, I know that 2020 has been a challenging year for everybody. Wearing a mask, not being able to hug your family, those aren't fun. But to make sure everyone's family and friends can get through the next few months, we have to take these steps. The virus, which has dominated our lives, is spreading. It is spreading too quickly and making too many people sick for the healthcare system to handle. Make no mistake, we're at war. And right here, right now, the virus is winning that war. And it will take significant and decisive action through individual acts and determined public policy to get us through. We're now going to take a look at some of the data which I received last night, which I think will more than drive the point home. So if we can switch over to our slides. These are some of the modeling slides that our analytics team puts together. To say they're scary, I think, is an understatement. This is what we project is going to happen over the next couple of months. What you're seeing on this slide here is if we delay implementing measures to get reproduction down to a sustainable level. The two curves that you see really describe the time. If we act now to get transmission down to a reasonable level in 2 weeks, we can expect this blue line. If we wait another week, you get the orange line. That is simply unsustainable. Next slide, please. This slide demonstrates the impact of decreasing transmission of the virus has on caseloads. So the blue line represents if we can get what's called the reproductive factor down to 0.8. You all know that 1.0 above that means transmission is going on, and below that means we've interrupted. So even if we interrupt transmission 2 weeks' time from now, we're still going to have over 2,000 cases. If we get it down to 1, it's even higher. If we can only get it down to 1.3, it's even higher. This means we have to act now. We have to act decisively. We know we're still going to get hit. The question is how much and how long. Next slide. This is a very scary slide. This shows our maximum ICU capacity. If we continue on the trajectory we're on right now, we will run out of ICU capacity the first week of December. So let me say that one more time. If we continue on the path we're on right now, we will run out of ICU capacity. We can't just make up ICUs. We can't make up critical care nurses. This is a finite resource of incredibly skilled people. We can't just make this up. Next slide. This is really just to emphasize the spread and where our patients are coming from. You've heard me talk over and over again about where patients are coming from. You heard in my remarks, there are no safe harbors anymore. Patients are coming from all over. Our hospitals are filling up or are filled. We're having to turn away transfers. You heard the stories about transfers to out of state. We're getting requests from far, far away to transfer patients to the St. Louis area. And we're just running out of capacity. Next slide. This is our epi curve. The reason to highlight this slide is we have taken steps before that have blunted this curve. If you remember back in the spring with our shutdown order, it was very effective in blunting the curve. Make no mistake about it, we dodged a bullet in the spring. Now you look at where we are. We are much worse than where we were in the spring. And we show no signs of slowing down. Next slide. This is really to highlight the entire region. All of these counties are within the St. Louis MSA. One thing that you will find remarkably similar about these is they're all going up at a very rapid rate. Again, to emphasize, there's no safe harbors anymore. There is no rural versus urban. It's everywhere. Next. This is the state. These are the major metropolitan areas in the state. Again, the common theme is there are no safe places anymore in the state of Missouri. Everybody is feeling the impact. I know in our healthcare systems, we all have facilities that are in different parts of the state. We can assure you that everybody is feeling the impact. Next slide. We typically do not show deaths in our press briefings, but we think it's important to highlight this. This number will go up. Not only COVID deaths, but we will have excess deaths in other diseases. And why is that? Because we are so constrained right now to provide care. You've heard the stories about excess deaths, heart attacks and strokes, other things. Those will continue. We will have excess deaths outside of COVID because the numbers are so high. Next slide. Our positivity rate is at 24%. Now this is our healthcare system's positivity rate. And we've never seen a positivity rate that high. This is really a harbinger of things to come. These are cases that are going to convert to patients, that are going to convert to ICU patients, and some of them will convert to death. Next slide. This is travel patterns across the metropolitan area. You'll notice that we haven't done much traveling while the pandemic has gone on. The thing that I wanted to highlight on this is that top line, that orange line. This highlights that the weather is changing. More people are not going to be able to go out to parks, to socially distance outside, to relieve themselves of a mask every once in a while, and hitting at the wrong time, where this shaded area is going up. Next slide. These next few slides I'm going to go through very quickly, but really this is to highlight how dramatically things have changed. Now we run our models every week, and we make adjustments to the model when we need to, when the data does not fit the model. We had to readjust the model this week because the data were just so scary. The orange line was the previous model, the blue line is the new model. It doesn't take a mathematician to figure out what the slope is here. The slope has increased dramatically, which means we are getting closer and closer and closer in a shorter period of time to reaching capacity. This is, like I said, this is a numbers game now. Next slide. This is just a larger version of the previous slide. Go ahead. And this is really to highlight the reproductive factor down at the bottom. This is what happens when the reproductive factor, which means when we have more transmission in the community, cases go up, hospitalizations go up. That is the way it works. In order to decrease census, we have to decrease cases. In order to decrease cases, everybody has to be bought in on the strategy. The people, leaders, individuals, everybody has to be bought in, or these numbers will continue to go up. Next slide. I believe that finishes my comments. I appreciate everybody's attention. If I'm not a dramatic guy, but this scares me. So now I think we're going to take some questions from the media.
County, St. Charles, Jefferson, Franklin County. Is there one county responsible for most of the hospitalizations?
No. So let me discuss a little bit about counties. So all of the counties now, and I think I showed that on the slide, are contributing now to patients. Now, early on in the pandemic, it was more concentrated in the urban areas. Later on in the pandemic, it was more concentrated in the rural areas. The challenge is there is so much virus circulating right now. We're getting patients from everywhere. And that's, like I said, there is no safe harbor. There is no one particular county that I would say is better than others or worse than others. Clearly, when we look at the data, we know that St. Louis City and St. Louis County, their rise in cases has been lower than the surrounding community because of the mandatory mask order.
With that in mind, have you considered asking individual county executives to require masks?
Well, I think we're being very clear on what the ask is today.
2 days ago, I was on the streets in St. Charles where there's obviously no mask mandate, and it seems some people are just digging in when it comes to being opposed to the mask mandate. They say it's still a religious conspiracy, et cetera, and stuff like that. You've been kind of sounding the bell for a while now. Is today, and these numbers, is this what's going to take to change people's minds? What's going to happen?
Yeah. Always a hard question to answer about what it's going to take to change people's minds. I'm hopeful that by showing the mere magnitude of these numbers and by talking about how this is impacting the healthcare systems, that we will begin to change minds. Part of the issue, I think, is we all have to speak with one voice, and that means healthcare, that means elected officials, other leaders out in the community, that this is real, and there are ways that we can keep the cases down. You know, we are trying to do some different messaging to reach more people. Not everybody hears the same message, so we are working on that. But I'm hopeful that just this dramatic show of events, this dramatic show of numbers, will have an impact.
Dr. Gardner, on the heels of this assessment, is there a scientific data somewhere that can be shown to naysayers, if nothing changes with the mask mandate, that masks are actually working and helping, so that if somebody doesn't believe in a mask,
Sure.
they look at data, even the government for that matter,
Yeah.
they go, okay, maybe I can think differently about this in some ways?
Yeah. Yeah, no, a good question. So we've consistently shown the data. I've shown data numerous times about how mask wearing decreases risk of transmission of the virus. To me, that's settled science.
I don't know if there's somewhere where we can help you,
Right.
and they can go look for it, so, hey, listen.
Yeah, you know, sure. Yeah, I think if that's what it takes, we're more than happy to put all of the research articles, all of the data on our website that people should feel free to go and search. I think the challenge is, you know, we argue with data. A lot of people argue with emotion. And so we have to be able to craft the message for both of those, for the logic side and the emotion side. That's where, you know, we're clinicians, we're scientists. We look at data and we're like, of course, that makes sense, right? But we know that we have to convince other people in different ways. That data is not always the answer. It has to be the message as well. So I don't want I want to involve my other colleagues here in the Q&A as well. So if we have some questions that they can answer. Specifically, I want to make sure that the nurses here can describe what's going on in the front lines as well, because I think that is a super important message that we need to get across.
Before that, can you tell us, when was the last time you reached out to Governor Carson's office and what was the response?
Sure. Maybe I'll ask Dr. Dunnigan if he wanted to make a few remarks.
Okay. Sure. Thank you, Alex. We've had pretty frequent contact with the governor's office, and that's been a repeated advice from infectious disease physicians across the state, from public health officers. So I would say probably not a day goes by that the governor doesn't hear from one or more of us that a mandate's required. Just a quick comment about that. I think, there are two basic reasons that people seem to invoke for not wearing a mask and not following social distancing. One is the one you just talked about. They just don't believe science. The other is the sense that this is somehow interfering with personal liberty, and American values are replete with stories of individual heroism and self-reliance, which are strong values that have served our country well. That's not what's at stake here. The individuals who say it's their personal liberty not to put a mask on are actually doing something that's a fundamental violation of what we consider the norms of society. There's nothing about our country that says it is okay for people to do things that put other people's health at risk. Not wearing a mask is one of those things. So that issue is something that we really need people to step up and help all our citizens recognize that. For those who simply don't believe, I think that's where we need a mandatory program, because there's nothing we're going to show them that can convince them. They've already seen and dismissed the science. So it's up to us to find mechanisms to compel those people to help the rest of us save lives.
Has the governor softened his stance for this at all in your mind, or is he staying on and saying, no,
The governor, I think, over the course of the pandemic has become convinced that the things we're advocating for, masking, social distancing, safer at home, I think he endorses those things. He continues to stick with his premise that this is a local priority and that local governments can take this and know best what's for their citizens. I think, unfortunately, what we're seeing is that's not the case. We see many examples where local authorities either don't appreciate or don't have the means at their disposal to get citizens to do what they need to do.
the state of Illinois has broken it down into regions which have similar makeup, etc. Does Missouri do something like that, rather than try for the entire statewide?
They've already seen and dismissed the science. So it's up to us to find mechanisms to compel those people to help the rest of us save lives.
Yeah, I think the political mechanisms by which this happened are not our expertise. We know it needs to happen, whether it's county by county or regional or state. We know what the solution is. It's up to political leaders and civic leaders to make it happen.
Doctor, what would you say to a state representative who tweeted earlier today, telling families they can't gather for Thanksgiving in their private home is unacceptable and something only a tyrant or dictator will do? How would you respond to somebody, an elected official, who tweeted something like that?
I would repeat, there is nothing in the makeup of our country that says it's okay to take actions that put other people's lives at risk. Gathering for Thanksgiving is something wonderful. I have 4 kids and 9 grandkids. I would love to be with all of them over the Thanksgiving holidays, but in doing that, we increase the risk that one or more people in that group will contract COVID and will take it to some other place and infect someone who's at risk for a serious outcome. So it seems heartless, but the fact is those acts, even though they feel good and they're what we want to do, they actually have a risk for other people downstream.
Other questions, particularly about the workforce?
I have a question from St. Louis Business Journal.
Yes.
They'd like to know how often hospitals reach or
or near capacity pre-pandemic?
Pre-pandemic. So maybe I'll ask one of our chief nursing officers, or Diane, if you could answer that. Just tell them.
Morning, everyone. I'm Diane Ray from St. Luke's Hospital. I'm the Senior Vice President, Chief Operating Officer, and Network Chief Nursing Officer. And first, I'll just say that I am really proud to be celebrating 40 years of being a nurse this year. And when I started off in 2020, I thought, what a great year this is going to be. Lots of celebrations. It's the year of the nurse. And it has been a great year for nurses because as nurses, we have joined our profession because we want to serve. And so the pre-pandemic numbers are nothing close to what we're seeing now. We did not have close to capacity numbers pre-pandemic like what we have now. All of our hospitals, including St. Luke's, receives continuous calls daily from outside our St. Louis metropolitan area to bring more patients to us. And so part of that, and of course we want to serve, we want those patients, we want to be able to take care of them. And so part of that has led to this capacity. But it's the virus that has led to it more than anything, as well as people that have potentially put off care because they're afraid. As all of us are, we're all scared. All nurses, doctors, respiratory therapists, every day we're scared when we are taking care of these patients. People are scared to come to hospitals. And so as they put off that care, when people now are seeking care at the peak of the virus, it's causing our hospitals to have a higher capacity. And unfortunately, that capacity is much higher than what it was pre-pandemic.
I just want to add one quick comment to what Diane just mentioned. So Keith Starkey from Mercy. So when we look back last week at the number of requests for transfers into the Mercy system, and this would include into our Mercy Jefferson and Washington, we had 129 requests for patients to be transferred from outlying facilities in. Unfortunately, 39 of those we did not have beds for. And so what happens to those patients when they can't be transferred? But I think more importantly is when you listen to what Dr. Garza just said, as these numbers go up, our ability to accept transfers goes down because when we are full, we are full. And that reality is really going to be challenging for everyone because, as Diane said, we want to be able to take care of those people who are ill, and yet we will be overwhelmed and unable to do so.
I have one question from St. Louis Public Radio. The question is, I think people in St. Louis are getting mixed messages. The county is shutting down businesses and the city is limiting gatherings to 10 people but keeping businesses open. Is the mismatch of policies, regionally, statewide, and nationally, creating confusion and fatigue among residents?
It certainly does. It's not ideal. Let's just put it that way. Particularly in the St. Louis metropolitan area, where we have such a wide degree of different jurisdictions, and each of them have different policies across the spectrum. And so, by not having a more coordinated policy approach, it does create confusion. But at its worst, it also creates this dichotomy of of populations that have more strict measures than those that don't. I know from talking with elected officials, there are feelings like we're doing everything we can, but other people are not sharing the burden, and I don't blame them for feeling that way. So, would it be helpful to have a coordinated strategy across the board? You bet. I liken this to my time in the military, and you cannot have an effective campaign strategy with 5 generals. That's why you have one. And then they set the tone. So, does it make it hard? Yeah, it does. But we all need to agree on certain basic things that can decrease transmission of the virus and save lives. Okay. Any other questions from the media?
I'm not sure you would quantify it necessarily, but you're hearing from the
I mean, it's a very simple answer, no. I've said to people, you know, this is a once-in-a-century pandemic, right? This is a disaster across the country that the likes of which we have never seen before in a generation. You know, history books are going to be written about this. And I think we all need to be cognizant of what side of history we're going to be on. We will be judged on things that we do and things that we don't do after this is all over. And the appropriate steps are not challenging to take. So I just implore everybody to do the right thing, make the right decisions. You know, show your kids, show your families what you're made of. Do the right thing. I don't understand sometimes why it's this difficult. But we all need to be doing the right thing. And history will judge us. It's time. It's time to do it. Any other questions? Okay. I want to thank everybody. I want to thank especially all of the clinical folks for coming by today and being here, and everybody on Zoom for Zooming in, and all the media as well for coming out to help spread the message. Very much appreciated. Thank you.